I guess it all started in high school. I was a competitive swimmer, and one day at a meet, I hurt my shoulder, so I had to go in and get surgery. So the doctor, after the surgery, sent me home with some meds. It was Percocet.
Until recently, our approach to treating patients with a substance use disorder, or SUD, emphasized acute and episodic care, focused mostly on the associated medical complications. For example, care in the hospital would have focused on an infection resulting from injecting drugs, or on wounds from a fight that occurred while the patient was intoxicated.
So there are 23 million Americans currently living with an alcohol or drug use disorder, and we've seen those numbers really increase over the past several years. And particularly opioid use disorder, or addiction to opioids, has been rising. So the #1 cause of accidental death in this country is actually unintentional overdose to opioids. And here in Massachusetts, we see about 3 to 4 people a day are dying from this disease. For every one death that we see twice as many hospitalizations and 4 times as many emergency room visits. And we know now, actually from decades of science, that this is a chronic disease. So just like diabetes or heart disease, it's about 50% genetic. And we also know that treatment outcomes are best when you treat this like a chronic illness. So the best evidence-based care approach to substance use disorder would be a continuum of services. So that begins with prevention in the community, so trying to prevent the disease from ever starting. And then that moves into the outpatient setting, where we want to try to identify the disease early, because we want to catch them before the disease progresses. For folks that do develop a severe substance use disorder, you need to have the ability to provide specialized services and chronic disease management. You want a team of experts that can see someone in that moment and really use that opportunity to engage with someone and to begin a long-term treatment plan.
This new interdisciplinary approach relies on a care team that includes a physician or nurse practitioner, a social worker, and a recovery coach. The team is committed to beginning care in the hospital and working with the patient to design long-term goals and a comprehensive treatment plan.
The team becomes the most critical part of how we actually can integrate and form these care plans. We do treat it as a very high priority while they're here, so they're seen every day if someone looks like they're going to benefit from that kind of motivational work. I think probably one of the most critical aspects that we were fortunate to add is the role of the recovery coach.
For you, like we talked about, we have you going to a group down at the West End Clinic. You're going to be one of the ways it works is it's the fact that the people that they're putting into the recovery coach positions are their peers of people with SUD. We're all in recovery of some forms. It gives the patient some sort of an identification. They know there's somebody there that's not going to judge them. It gives them what we like to call the transmission line.
Their main job is to form a relationship to the patient and then to get rid of any barrier to recovery.
When they're actually out of the hospital and they've done, they've gotten themselves medically better, I mean, that's where this is different than other diseases, because that's where all the real work begins.
It's amazing to watch these people. They help us understand what it is to be in recovery. They give us hope that recovery can happen, because there they are, living proof of it. And when we get discouraged or we are not sure, we only have to really look to them.
The process has become like it should have been for a long time. It's become like a medical protocol, and we make progress every day.
I mean, I think we're really hopefully changing something and creating the beginning of a movement to treat addiction truly as an illness and to begin to shape people's experiences when they come to the hospital, and also the public perception of what addiction is and what it means to be a person in long-term recovery.